right, let's take you now live because President Cyril Ramaphosa is in the Eastern Cape, of course, today to track the province's progress in response to the COVID-19 pandemic. Our reporter, Anda Ngonji, in Port Elizabeth has been following that story. And I can see that Dr. Cyril Mkhize is talking there. Anda, should we listen in to what he is saying as Health Minister?
So doctors who are going to be employed very soon. And then the third area was the area of protective clothing. This has been a sore point for a long time, and in this case we have sent the last two visits I was here, we brought in the chief procurement manager from the Department of Health to come and look around to see what is the challenge with PPE. We realized that the real issue was the systems of being able to manage the stock in the district so that one hospital can have stock and the other one doesn't have. They need to be able to deal with that, to also deal with the issues of training on what level of PPE you need for what level of protection and so on. So that work is being done. Now we have seen that there are some protests that are coming up. A combination, some are still raising the issues of PPE, and so we believe they must deal with that. The last one was infrastructure. We came to show the president on the extension of the infrastructure, new bed. So we're very pleased with that, and so I want to just leave it at that because it was really for us to come and account to the president that some work is being done in this regard. Thank you.
Thank you, Minister. Sorry, before we get the president, can we ask that you move a little bit this way? Some space? Yeah.
And have you heard about something called social distancing? Doesn't look like you are observing.
Okay, Mr. President.
No, thank you very much. I've been very pleased to be here and to have spent quite a number of hours with the Minister of Health, Dr. Mkhize, as well as our Premier and the MEC of Health and other MECs. It's been a very fruitful day, a day of good engagement, where the province has been able to give us a full explanation of a number of things that they are working on in relation to COVID-19. We were obviously concerned and are still concerned about the rising numbers of infections in the Eastern Cape. They have been able to lay out their strategies of dealing with COVID-19 and taking really aggressive action in relation to seeing how best we can reduce the high numbers of infections. They've addressed the issue of human resources. They've brought in a number of health and community workers who are going to do screening so that testing can then happen. They've taken preparatory measures in terms of setting up field hospitals in a number of areas so that those who get infected are admitted and are treated properly and humanely. Like here at this stadium, there are people who have already been admitted and who are being treated. And we went to Livingston Hospital. Some had been admitted, some have now recovered and have gone home. And they've also been able to outline to us some of the challenges that ordinary people are facing. The Eastern Cape is one of the poorer provinces in our country where there's grinding poverty in a number of areas, and we've got about 400,000 households that live below the poverty line, and that is a major concern to the province and to us, and they've had to utilize their own money to try and address this, and we will be assisting them at the national level as much as we possibly can. And they've also been able to outline to us the challenges that are going to ensue post-COVID-19. In fact, as we speak now, this is playing itself out, the economic challenges with a number of companies facing serious difficulties, and some may even face greater difficulties in a few weeks to come. So the economic challenges are huge, but what was pleasing is that they are already looking beyond COVID-19. They are looking at the economic recovery that must happen here in this province. And we're going to see how best we can assist the province when it comes to the broader economic recovery that we need to embark upon as a country, as a nation, to try and save jobs, but also to create more jobs. So there's a lot of work that needs to be done. But I was very pleased to see that the province is working very hard to try and address all the challenges that we are facing right now. And the health response, they have really taken it up seriously and are doing everything they can. And I was pleased to hear that they've already screened more than 1 million people, and the testing is going up. And of course, they need more PPEs for medical staff, and we would like the medical staff, the health workers here to get the personal protection equipment that they deserve, because they are putting their lives on the line for all of us as South Africans, because they are taking a huge risk. So we want to protect them. We want to make sure that when they go out to work amongst our people, either here in this stadium or in other field hospitals that are going to be set up, they have the security of knowing that they are well protected themselves. So we will be taking steps to give them that protection through our procurement system. But all in all, I think the visit has been a really good one, and the province has demonstrated to us that they are up to the task. They are able to ensure that we lower the curve of the infections, and I have no doubt that they will. Thank you very much.
Guys, I'll take 3 questions maximum. Do you have your hand up? Robin, you're 1, you're 2. Okay, I've got 2 questions. Robin?
Mr. President, Govin Wickles from ENCA.
How are you?
I'm well, thank you, sir. Good to see you well.
Good to see you.
What do you think of the debate around the mandatory hospitalization of patients that have coronavirus in order to stop the spread of the virus anywhere else?
Well, I think it's once you have the virus, as the doctor will say, you become infectious. So what we've been saying is that once you have it, we've got to have you isolated, because if you're not isolated, it's likely, and it's not even likely, it's a sure case that you're going to infect a whole range of other people that you'll be in touch with. So it's not a violation of your rights, it's actually the securing of the rights of other people and your own life as well. So we believe that it is a correct thing to do, that those who have the virus should be put in hospital so that we can manage the virus and try and, 1, isolate them, and 2, make sure that we manage it and we help them and to get their bodies to be in a situation where they can fight the virus. Because we don't have a vaccine, we don't have a cure. So it is important for the sake of others that they should be in isolation and quarantine.
Thank you. Susan, you had a question?
Mr. President, I would like to find out, I'm sure most South Africans are interested in this. By the way, my name is Nkonji from SABC. I would like to know, when can we see the Cuban doctors, beginning to get into action? We know that they've been under quarantine for quite some time now. When will we see them coming to us?
Well, this is the man you should be directing the question to. So I will pass on this one, because he is the boss of the Cuban doctors. So Dr. Mkhize will answer that one. What I did was to call the Cuban president and ask him to send us their top specialists to come to South Africa. They are now here, and Dr. Mkhize has received them, and he's the one who's deploying them throughout the country. And I'm really pleased with the plan that the minister has laid out to have them deployed to all the provinces of our country. And I'm also glad that the Cuban government has deployed as many as they have to come to South Africa, because we have a very special relationship with Cuba, which emanates from Madiba's time with Fidel Castro. And we are very proud that we've continued with that tradition, even ourselves who have succeeded Madiba in carrying out the work that he and Fidel Castro carried out. But Minister Mkhize will answer that.
No, President, you have answered the question. They'll be out anytime. As soon as we are ready, they're being orientated now. So when that is done, they'll be ready to come through. The President is right. We're very happy to have
Thank you.
them.
Last question, ma'am. You have a question? President Farah from the Burger newspaper and Network 24 News. Can you perhaps give us an estimate as to how long your consultations will take before announcing level 3? And also, will the sale of alcohol and cigarettes be legal?
Wow. I knew the cigarettes and alcohol will come up again. No, the consultations are starting tomorrow. We have already said that we are moving to level 3. What we are really consulting about is the measures that should be part of level 3. And that's what we will be really focusing on. So we're starting consultations tomorrow with NEDLEC. We'll do our provinces the following day, and we will do a whole number of other parties. And this is the way we work. We want every South African to be part of the process of embracing this level that we are going to. And I want to repeat again, we are not forever sentenced in these coronavirus levels. We are going to get out of these levels and resume our lives. But when we do so, we should be in a position to have the tools and the instruments to enable us to change our behavior, to change the way we relate to this virus, because this virus is going to be with us for a very long time. Now, as regards tobacco and cigarettes, I think let us wait for that moment when this matter will be dealt with and finalized. Thank you very much.
Thank you, Mr. President. Thank you, ladies and gentlemen.
Thank you.
We are going back
All right, that was the President and the Health Minister speaking in the Eastern Cape. He has been shown, as he said, various facilities there. Some concern about the rate at which infections are rising in the Eastern Cape. And as the President said, poverty levels higher as well. So he couldn't answer the thorny issues around cigarettes and alcohol, saying those consultations still have to take place. All right, we'll go back to our reporter there, get a little bit more details around today's visit and bring you much more news. We take a short break. Stay with us, and it is unfortunately time to say goodbye to our viewers on SABC 3.